Deputy Chief Medical Officer Nick Coatsworth.
To 12 noon today, there have been 9,797 total COVID-19 infections diagnosed. There have been, regrettably, 108 people who have died from COVID-19, including another death overnight, a gentleman in his 70s. Number of cases confirmed in the 24 hours to 12 noon is 279, of which 273 are in Victoria. There have been 5 cases diagnosed in New South Wales. 2 of those individuals were in hotel quarantine and had acquired their infection overseas. 3 local cases were confirmed who were household contacts of one of the people who contracted COVID-19 in southwest Sydney. 7,728 people have recovered from COVID-19, and in terms of current hospitalisation, 67 people are hospitalised and 17 of those are in intensive care units. We have a very specific message today which has been shared with us by our New South Wales Health colleagues and their Chief Health Officer, Dr. Kerry Chant. Anyone who was at the Crossroads Hotel in Casula in southwest Sydney between the dates of the 3rd of July and the 10th of July, anyone who visited that particular venue, you are required to self-isolate until 14 days after your visit. Furthermore, if you are at that particular pub between the 3rd of July and 10th of July, you are strongly encouraged to get tested regardless of your symptoms. This is because that venue is currently the hub of the public health investigation into the small cluster in southwest Sydney emanating from the Crossroads Hotel. It is critically important that if you were there during those 3rd of July and the 10th of July, that you get yourself tested. Once again, in this case, regardless of symptoms. So whether you have symptoms of a cough or cold or not, but you are at that pub, do get yourself tested. That includes people who have now left New South Wales, but who may have been at the pub between those dates. Hence, we're making it part of this national press conference, including freight drivers, because that is a particular venue that is also frequented by people who do transnational freight driving. If you are one of those drivers, whatever jurisdiction you're in, do go and get yourself tested, minimise your contact with others for the 14 days after your visit to the Crossroads Hotel in Casula. This is a timely reminder that infectious diseases of any sort, particularly ones of pandemic potential, highly infectious ones, do transmit through or do travel through transport hubs. And the Crossroads Hotel in Casula is on the Hume Highway, of course. That is not to say that people can't frequent those venues. Of course you can, within the restrictions that the state governments have put on numbers of people and density. But people need to be very cautious. Certainly if you have any symptoms of a cough or a cold and you're on the road, don't drop into the roadhouse and sit down and have a meal. Obviously, do things like get a takeaway. If the place looks full, move on to the next venue. These are just important basic things that we are all going to have to do with COVID-19, with the COVID-19 epidemic. So with that in mind, I'm happy to take some questions.
Border closure, given that this virus is likely to be around for potentially years to come, is there an alternative to dealing with outbreaks to the sort of lockdowns we're seeing in Victoria and border closures? And do you think the measures that we're seeing in Victoria, are they really sustainable in the long term if a vaccine is not available in the next couple of years?
So I guess the first thing to say, and one of the positives, is that an immense amount of human capital is being devoted towards developing a vaccine, including a vaccine that is going to...
Most people say it's a couple of years off, probably. Is that fair?
just finish the answer, including the vaccine that was that has recently gone to human trials from University of Queensland. So I think you're quite right. I think that there needs to be some degree of preparation, as I said yesterday, for an Australia that doesn't have a vaccine. So we hope for a vaccine to come as quickly as possible, but it may not come for many months. In that sort of situation, it is the case that movement restriction and decreasing mixing of individuals is one of the main weapons that we have against COVID-19. But the key, of course, will be to get this under control, and it won't last for many, many months. This will be brought under control by the movement restrictions that Victoria has imposed in Greater Melbourne and Mitchell Shire. We know that because once movement gets to decreases to a certain level, and this has been the case in any situation of a second wave around the world, that the numbers eventually start to drop again. The key after that, of course, is to make sure that community transmission stops, that there are no cases of unlinked community transmission, and that we do our best to maintain the security of our borders through hotel quarantine and so on and so forth. So I think rather than suggesting that we will necessarily have a period of several months or years where we have lockdown after lockdown after lockdown, I don't think that's necessarily going to be the case at all. I think the focus is to get this particularly large, significant outbreak under control in Victoria, and then go back to what we do best, which is contacting, tracing and eliminating small outbreaks.
So that would be an unsustainable way to deal with it in a sort of medium-term basis over more than a year, is to continually lock down places where there are outbreaks.
No, I don't think it would be fair to say that that was an unsustainable way to deal with it. The reduction in movement, the reduction in mixing of people is something that is our main tool to deal with COVID-19. What I don't think we should suggest is that there will be outbreaks of the extent that we've seen in Victoria that would then necessitate the sort of stage 3 restrictions and the border closures that we've seen in response to this outbreak.
Given that we now know that people can catch this virus and can transmit it even if they're not showing any symptoms, what's the current advice around asymptomatic testing? And would you like to see that in more broadly across Australia, especially in New South Wales, given that we're now trying to work out if this Victorian outbreak has moved across the border?
So one of the challenges with COVID-19 is this asymptomatic period, and it's probably better characterised as a pre-symptomatic period before which you'd start to develop symptoms, but you're nonetheless infectious. And that informs our national testing and contact tracing guidance, of course. That's why we ask who have you been in contact with for the days before your symptoms arose. The likelihood of people who are truly asymptomatic transmitting the disease is not known. The reality from the Victorian experience that we've seen is that there have been many, many thousands of tests conducted on asymptomatic individuals for very little yield. When I say yield, very few positives out of the asymptomatic testing that's been conducted down there. So your biggest bang for your buck is still to focus your testing on the symptomatic individuals. That is still going to be the way that you detect most of the cases of COVID-19, and that's still going to be the way that you get control as quickly as possible. The asymptomatic test has a role in places where there's local small clusters. So the Casula case is a very good example. So we don't want to miss any cases in that sort of scenario. Therefore, we're going to recommend asymptomatic testing. There wouldn't be any value to go elsewhere in New South Wales or in Queensland where there was no COVID-19 and test people with no symptoms. Frankly, it'd just be a waste of a test. So that's the difference. That's a nuance behind asymptomatic testing. We will use it in situations where we absolutely want to guarantee that we don't miss anything, and that will be in the small cluster like we've seen in South West Sydney.
You recommend people in Melbourne, if they can't socially distance, to wear a mask. What is the threshold, though, for other cities or areas? For example, with Casula, would you be recommending people there wear a mask considering there's concerns about an outbreak there? Just a bit of your thinking behind when we get to that point that it's necessary.
I understand, and what I understand more broadly as well is that people are looking for thresholds at which we make decisions. It's very hard to provide that because if you get to a given threshold, you might be heading up the curve, you might be heading across, or you might be heading down the curve. And there's various situations, various other contextual matters that we need to take into account that are not just the numbers. The New South Wales Health Department has recommended an increase in personal protective equipment for their hospitals in those local health districts around Casula. So that's a good example of where we're increasing the personal protective equipment use. For community mask use, I think you've seen that our switch occurred when Victoria clearly had significant community transmission. And so the recommendation remains the same. We watch to see what's happening with community transmission, and if it is significant, as it is in those areas of Victoria, we recommend mask use. Masks are part of a suite of measures, like we've always said. There is a tendency, and there are those who we might even describe as mask messiahs, who would put a lot of faith in the ability of the mask to control these outbreaks. We accept as the AHPPC that they have a role. We also know that the main game in controlling COVID-19 is movement restrictions and social distancing.
That was the Deputy Chief Medical Officer, Dr Nick Coatsworth, echoing the message from New South Wales authorities today, urging people who had been at the Crossroads Hotel between the 3rd and 10th of July to self-isolate for 14 days, as well as look at getting tested. Also commenting on the Victorian situation, saying that whilst there is a lockdown now, he doesn't expect that outbreaks will continue to be this bad, which would require a lockdown to continue to happen. But